Some medical conditions that can cause erectile dysfunction. Before we talk about these medical conditions that can cause erectile dysfunction, let's quickly define erectile dysfunction. Erectile dysfunction is simply defined as the inability of a man to maintain or attain erection that is strong enough for sexual intercourse. Wetin be erectile dysfunction? If I wan use our pidgin wey we sabi well for Nigeria, I go define erectile dysfunction as dat condition wey you get as a man wey e be sey you wan try make your body stand so dat you go fit have intimacy with your woman, but your body e no dey fit dey stand, or your body go stand small before you know e don fall. E no go fit dey firm enough so dat you go fit have intimacy with your partner. Na dat one na dem dey call erectile dysfunction. Now, in dis video, we will be revealing some medical conditions that can cause erectile dysfunction. In other words, today's focus will be on causes of erectile dysfunction, because I've seen many men approaching the pharmacist, approaching the pharmacy, approaching the medical doctor or medical doctors, complaining of erectile dysfunction, not knowing that it could be as a result of their underlying medical condition. On that note, before you even visit your doctor or your healthcare provider complaining of your erectile dysfunction, it is good you know some medical conditions that can cause erectile dysfunction. It could even be that your erectile dysfunction is even caused as a result of these medical conditions, if you have one or two of these medical conditions. Now, what is the first medical condition on my list? The first on my list is the one when all of us sabi, when everybody sabi well well, when dem dey call hypertension, high blood pressure, or BP, high BP, high blood pressure. High blood pressure na one of the number one cause of erectile dysfunction. Now, if you be man say you don dey, your age don reach 40, 45 and above, and you come see say as you clock dis age range, na you come start to dey get erectile dysfunction, I go advise you first thing make you go check your blood pressure, make you make sure say you no get blood pressure. And if you get blood pressure, make sure say you dey control your blood pressure well, you dey take the medications wey your doctor or your healthcare provider recommend for you, so that you go fit bring down the blood pressure. Because if your blood pressure no come down, erectile dysfunction go persist. Now, that's the first. Another condition that is also common that can cause erectile dysfunction is what is known as diabetes mellitus. Diabetes mellitus is another medical condition wey dey cause erectile dysfunction. Na dat one na many people sabi as, dem say e get sugar, e get diabetes, e sugar too many for e blood. Dat one go fit also cause erectile dysfunction. E go fit make man blood no dey flow well. E go fit damage some of the blood vessels wey dey body, and as a result of that, e go fit make somebody come dey get erectile dysfunction. So if dem don already diagnose you, you already be diagnosed to have diabetes, you now discover that you are having erectile dysfunction, try as much as you can to adhere to your prescriptions concerning your diabetes, so that your blood sugar level will be normalized. If your blood pressure is normalized, you can maintain a better erection. Now that's two conditions. Another one is what is referred to as hyperlipidemia or atherosclerosis. When there is too much cholesterol, bad cholesterol for the body, when it too much, it can also cause erectile dysfunction. Then another condition that can cause erectile dysfunction is obesity. When you get too much fat, too much weight for body, that one go fit also predispose you or make you come up with erectile dysfunction. Now we don mention four now, make I recall the four wey I don mention before I go proceed. First of all, I said high blood pressure, hypertension can cause erectile dysfunction. Diabetes mellitus can cause erectile dysfunction. High lipid, high cholesterol, hyperlipidemia can cause erectile dysfunction. Then I said obesity can cause erectile dysfunction. Now there are other conditions that can cause erectile dysfunction, like neurological conditions like stroke, Parkinson disease or Parkinson diseases can also cause erectile dysfunction. So if you are battling with erectile dysfunction and you have any of these mentioned medical condition, always try as much as you can to adhere to your prescriptions or talk to your healthcare provider if the medications prescribed to you, if they are not helping, so that another medications can be recommended in order for you to maintain or control these conditions, and so that you will be able to maintain erection, proper erection, and enjoy your bedroom performance and intimacy with your partner. Thank you so much for paying rapt attention to this video. I will draw the curtain here. Now that we have known the meaning of erectile dysfunction, and we have also known some of the medical conditions that can cause erectile dysfunction, in our next video, we will also look at another topic, either look at how we can manage erectile dysfunction, or we can also look at some other causes of erectile dysfunction, or we can even discuss premature ejaculation. Don't worry, I will keep you updated. Any of the condition that we'll be discussing, or keep our topic that we'll be discussing, you guys will be updated. Now I have a community on WhatsApp where you can reach me. I will drop the link in the description of this video. You can reach me, and so that I can add you to that community. If you have any questions, any comments, you can let me know in the community. Or better still, if you have questions regarding to this video, don't hesitate to drop your questions. And please, 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 I beg you, this is a new channel that is dedicated to educate men concerning their health, especially bedroom health, sexual dysfunction, and any other sexual abnormalities. So I will beg you to subscribe, so that will encourage me to do more videos. I will see you next time. Bye, bye, bye. I remain Dr. Festus Enehai Famdi.